Welcome to Managing Myeloma. My name is Philip McCarthy. I'm a professor of medicine at Roswell Park Cancer Institute, and I'm frequently asked, what are the essential considerations in a survivorship plan for multiple myeloma? Well, after primary treatment, and if the patient is on maintenance, I think many patients will be, they should be monitored at least every 3 months by urine and serum to make sure they don't have disease progression. There are very rare cases where patients can be monitored every 6 months if beyond 5 to 10 years from last therapy. But in particular, if you have a patient who's on an IMiD, they need to have a CBC done at least every now and then to make sure they're not having trouble with their blood counts, as they can be relatively asymptomatic and yet be fairly neutropenic. DEXA scans or bone density scans are often done after bisphosphonates are stopped to look for early osteoporosis. And in particular, we want to make sure that these patients are also sent to their dentist to make sure that they have adequate teeth hygiene, and also to make sure they don't develop osteonecrosis of the jaw. Immunizations are a real big deal. A lot of patients with myeloma, because of the fact that this is an immunoglobulin disease, will have loss of titers against a variety of different pathogens. So we think after primary therapy, immunizations are very important, especially after transplant. The patient is on an IMiD. They often can be immunized, and it actually enhances the effect of the vaccine. There is controversy as to what to do with the live vaccines, such as MMR, and in particular the zoster vaccine. There's not a lot of data on this, but it's at least something to consider, because if you have a patient who has no titer to varicella, they're going to be at very high risk for developing shingles, and so they should stay on acyclovir prophylaxis if they're not going to be vaccinated. And if they're receiving bortezomib, they also should be on acyclovir, because bortezomib interferes with immunoglobulin production in particular to varicella. So we're going to need some more data regarding this, but we hope to see this in the future, and it's an important point. We do know, for example, that Zostavax can be given after auto transplant at least 2 years afterwards, and hopefully we're going to see that moved up so that we can better protect our patients. And of course, for patients who are receiving IMiDs, venothrombotic embolism prophylaxis or DVT prophylaxis is very important because these patients are at risk for developing thromboembolic events. Thank you very much for viewing this activity. For additional resources, please view the other educational activities on managingmyeloma.com.